So, good morning, everyone. My name is Festus Kuushomwa from Namibia. Now, we conducted a systematic review on the socio-economic and cultural determinants of malaria transmission in Ohangwena region. That will be my presentation outline. Introduction. Malaria remains a global concern despite effort to eradicate it. Globally, in 2022, about 249 million malaria cases and about 608 death cases were reported. And similarly, about 1,292 cases were reported in Ohangwena regions in 2023. So malaria control interventions has not really addressed the root causes of malaria transmission in the regions and in Namibia in general. So the purpose of this study is to investigate how the socio-economic and cultural determinants are associated with transmission in the region, and also to develop strategies that will reduce the malaria incidence and case fatality rates by 50%. Now, in terms of methodologies, we did a mixed study designs. The first one being the literature review, whereby we reviewed about 55 studies that were conducted in other African countries, and especially those that were done within 5 years. We also did in-depth interview with community members and healthcare workers from the villages that have reported high number of malaria cases this year. So the findings of these results were analyzed and organized thematically. The desk review for epidemiological data, and also the socio-economic and cultural profile for Ohangwena regions was also done. Now, in terms of epidemiological data, we have learned that by looking at the trend analysis, we have learned that Ohangwena regions has been endemic to malaria cases over the years, and you can see that in 2020, about 2,328 cases were reported, and similarly in 2024, this year, already 2,129 cases and 6 death cases were already reported. So this is a clear indication that malaria is really a threat to Ohangwena region, and it's high time we study other contributing factors so that we can address them. So in terms of the regional socio-economic and cultural profile, we have learned that the region is characterized by poverty, low level of education, limited access to health facilities, high unemployment rates. There is cross-border migration between Namibia and Angola, and the region is also prone to flood during the rain season. So this is just to mention but a few. So the results, fishbone analysis was used to determine the root cause of malaria transmission in the region. So first we look at the socio-economic factors, whereby poverty came out strongly with financial constraints hindering access to prevention measures. We learned that agricultural and outdoor works increases vector exposures. Cross-border trading also facilitate disease importation in the country. The household designs allow mosquito entries and biting. low level of education and poor understanding about the intervention hinder healthcare access or seeking behaviors from the community, and also on the use of the prevention measures. So access to health facilities is affected by the high transportation costs, the long distance to facilities, and also sometimes the unavailability of treatment at the facility level. So in terms of cultural determinants, we learned that there is a misconception from the community about the malaria disease. People believe that malaria is caused by witchcraft or supernatural causes, and because of this, community members tend to seek medical or health care from the traditional leaders, and this delays the health seeking behaviors from the modern health services. So there is also the issue of the safety and the discomfort as related to the use of bed nets and mosquito repellents, and also the indoor residual spraying. So people tend to hesitate to use those prevention measures because of the discomfort. The issue of gender disparity also delays health care seeking behaviors because women and children have limited control over households resources, making it difficult for them to afford um, transport and other related costs. So, so in conclusion, the study confirmed that socioeconomic and cultural determinants contribute to malaria transmission in the region. The key determinants are poverty, low level of education, awareness, limited health access, and cultural barriers. Community-driven strategies are needed, including expansion of outreach services, community engagement, and stakeholder collaboration. So we recommend to implement poverty-related strategies to improve awareness and access to prevention tools by lobbying for donation, subsidizing prevention resources, and stakeholder collaboration. Two, community engagement and education to address cultural beliefs, gender disparities, and other factors by sensitizing community leaders, involving community healthcare workers and traditional healers, and also to distribute educational materials. Three, strengthening healthcare access at the community level in underserved areas by expanding outreach services and community-based services. Uh, all this can be done by the Ministry of Health and Social Services together with local partners and donors um, by next year, 2025. Thank you very much for listening to my presentation. That is the end.